Here I am going to tell some of the important aspects of homeopathic system of therapeutics in management, particularly prevention of COVID-19. As every one of us know, homeopathy is a scientific system of medicine capable of using scientific approaches in each phase. And for the prophylactic purpose, we tell genus epidemicus or GE. During this outbreak of COVID, homeopathy has introduced arsenic alpha 30 as preventive medicine or immune booster medicine and distributed all over India. Many may have doubt how we come to this genus epidemicus. I think nowadays it is a dispute between the other systems of medicine too. So homeopathy is a scientific system I taught earlier. We have our own philosophy and scientific approach to find a medicine for a disease as well as a preventive medicine or prophylactic remedy. It is identified only after studying a number of cases from the targeted population. A working case definition of the prevailing epidemic is developed. Cases are studied, symptoms are classified according to its frequency and intensity, and finally a repetition is done. After all this process, we will get a most similar medicine, which is differentiated from the list of medicines. This is the procedure for developing GE or genus epidemicus. So this time we got this arsenic alpha and distributed everywhere in India. So let us come to the homeopathic system. Homeopathy is based on, I already told, based on particular or important principles or cardinal principles. And we are coming to a medicine through the use of our instrument in an artistic way, that is organ of medicine. As everybody know, organ is our weapon by which we can classically, artistically and scientifically we can treat a patient. Organ consists of around 291 aphorisms in the 6th edition, and the book is divided into two parts, as we know, doctrinal part and practical part. The aphorisms till 71 is the doctrinal part, and 70 to 291 is the practical part. And the doctrinal part is the part where it deals with the knowledge of the disease, the knowledge of medicine, and the administration of remedy. Then the practical part comes from 72 to 91, where acute and chronic diseases are there, case-taking method is there, including individualization, then drug proving, drug dynamization, etc., etc. So after all these methods, we are coming to the individualization of the case through totality of symptoms, and we will finally come to a particular or a similar medicine. So when we consider Dr. Hahnemann, our master, I think two things or two discoveries are very important I think that is the theory of the miasms and chronic disease. These two are the important discoveries of Dr. Hahnemann. So when we treat chronic diseases, it starts very slowly. Chronic disease starts with chronic miasm. It is proceeding the same way. If it is treated, we can come to a cure. Otherwise, it will destroy the organism itself. So while treating chronic cases, chronic diseases at Dr. Hahnemann's time, some diseases are cured even though treated in the right manner. So that is the case Dr. Hahnemann thought regarding the concept of miasm, why it is happening. So after the discovery of miasms, Dr. Hahnemann himself said, I could cure a large number of diseases which I couldn't earlier. That is, earlier means before the discovery of miasm. Even now, the concept of miasm is a dilemma. Naturally to say, it's a dilemma to every homeopath. So it's very difficult to understand what the miasm is, what the totality symptom. So the concept of miasm is the product of a logical induction of Dr. Hahnemann. It's a logical induction. The concept is not material notion. It is not at all a material notion, but it is something like the concept of totality. Miasm is not defined on the basis of disease, pathology, symptomatology, history of the patient or family history alone. But miasm is defined by combining all these together, all these symptoms together. When you combine all these, you get an idea, an insight to the total process of disease and its evolution in the patient. Again, I am saying it is an insight to the total process of disease and its evolution in the patient, which we call a miasm. So, miasm is an essential part of the totality of the patient. From the existing picture of the case, we derive the miasm. Then we add this miasm to the existing picture. So we get a totality. This is a secret in which miasm upgrades the existing picture into a totality. So miasm is the integral part of totality. We know Sora, syphilis and psychosis are the miasms. I'm not going into the details because it is well explained in Organ of Medicine. So, totality of symptom, what it means? Totality of symptom implies not merely a numerical aggregate of all the symptoms. It is not the numerical aggregate of all the symptoms then, but it relates to the synthetic comprehension of a concrete individual picture of the patient through logical combination of general symptoms, particular symptoms, peculiar uncommon symptoms as manifested by the patient. So this is the introductory portion of homeopathy. So I thoroughly explained the prophylaxis medicine we got. When we consider the treatment aspect of homeopathy, it is having a very good role in the treatment of chronic diseases. It's very important. So regarding the treatment, we have to consider some of the important aspects. That is, the real and well explained case taking is needed for the purpose. Then we have to follow the Dr. Hahnemannian principles, we have to follow the cardinal principles of homeopathy: selection of potency, repetition of dose, etc., for the proper treatment of homeopathy. Homeopathy is based on law of single medicine, law of similar medicine, and law of minimum dose. Anything which is not according to these principles, we cannot say it is homeopathy. So when we consider the case-taking performer, I think in the second year we are all studying organon, or I'm not. I will say the name of the. I will say the name of the book. Again, I will tell you. So when we consider the case-taking, the patient's story, then modalities, physical general, mental general, the condition of every system and organ, past history, family history, physical examination and lab test, etc., etc. So we consider the mental part. For the easy way of case taking, the mental general can be divided into 3 parts, that is will, understanding and intellect. So these 3 subdivisions will explain how we can get the mental picture of the patient. Love, hate, sex, etc., voluptuosity, desire, etc. comes under will. Delusion, confusion, etc. will come under this understanding. And this concentration, mistakes in reading, writing, etc. come under this intellect. So we will come to the totality of symptom, then we will come to a single medicine. We are applying this medicine to the patient. There are observations by Dr. Kent. After application of drug or the medicine, we have to continue the treatment. Then comes the actual problem of treatment. How we will prescribe a dose. What is a dose in homeopathy? The dose is a particular dose, means it can affect upon our vital force for the complete cure. So we treat according to the cardinal principles of homeopathy. Then comes the selection of potency. Selection of potency, it depends upon 5 or 6 points in organon, the seat of disease, the susceptibility of the patient, etc., etc. If the patient is having intellectually more or higher level, higher potency can be given. If the patient is suffering from a chronic disease for a long time, low potency is done. The patient is deaf or dumb, or intellect is lower level, low potency is to be given. More the susceptibility, higher the potency. This is the principle. So the treatment is going on. Then comes the second prescription. That means can be a repetition of the remedy, or can be a complementary remedy, or can be an antidote. So when we give medicine, we have to think all these things. You have to go to this boric. In the final part of this boric is done, complementary, antidote, remedy that follows. Particularly when you treat a chronic disease, you have to think all these things in the right way. Homeopathy is a science and art. It is having a scientific and artistic approach. So these are the preliminary things to be noted when you treat a patient according to homeopathic system of therapeutics. Okay. Thank you.